Hello, I'm Richard Matthews. I'm a consultant cosmetic and reconstructive plastic surgeon, and I work at the Nuffield Health Warwickshire Hospital, which is where my private practice is based. And I also operate at the BMI Meriden Hospital in Coventry, and I consult at the Renatus Clinic in Rugby. And I hold a substantive consultant post within the National Health Service. I'm going to talk about eyelid surgery. Problems with eyelid folds or bags or both are very common, and I treat a lot of patients who come to see me about this. The problem may be simply in the upper eyelid, or simply in the lower eyelid, or both. Very often it exists in both, but has only really been recognised in either the upper or the lower lid by the patient, and this is the only area where I will ever suggest to a patient that they might like to consider having either the upper or the lower done as well, because if one is corrected, they're then going to notice the other much more than they'd realised, and of course it's much cheaper to have them both done at once. There's no pressure, but it's simply to make them aware of the situation. The operation for correcting eyelids is called Blepharoplasty. Blepharon, Greek word for a lid, plasty from the Greek word plastos, I fashion or remold, so refashioning the eyelids. With regard to upper eyelid surgery, the general problem is a fold in the skin between the eyebrow and the eyeball portion of the lid itself. And that will extend from the inner corner of the lid out to a point below where the eyebrow finishes. And that's a point that people often haven't really quite taken on board. The eyelid is thought to stop where the eyelids join at the outer corner. That's not true. It extends further out. If one simply stopped the operation there would be a big bulge and fullness left behind. So it's necessary to chase that right out. Lower eyelids are a bit more complex than upper eyelids, and there may be all sorts of presentations. Very loose skin in this sort of area here, an indentation there, fatty fullness in the lower lid, a secondary eyelid bag in this sort of area here. So, like every other consultation that takes place under my care, all these aspects are analysed extremely carefully to decide exactly what the problem is. Once you've identified the problem properly, then you can devise a strategy to solve it. With regard to the scars in the upper eyelid and the lower eyelid, these tend to fade really pretty quickly and pretty well because the skin is thin and the blood supply is good. Nature looks after that much more quickly than it might do elsewhere in the body, and anyway, any slight persistent redness in the scars, which may carry on for perhaps several months after the surgery, is during that time perfectly disguisable with makeup. Obviously, in quite a short video like this, it's not possible to be absolutely comprehensive about problems and complications following surgery, but these are discussed in great detail and comprehensively at my consultation, which is not a brief affair, and furthermore are summarised in a detailed letter to all my new patients after the consultation, so that there's no question of doubt about any aspect, and it's perfectly possible to come back, ask further questions, have another consultation if necessary if something is not absolutely clear prior to surgery. Eyelid reduction, blepharoplasty, is a procedure I do a lot, and the results really are very gratifying, and it's possible to help people a great deal with this operation.